Hi everyone, today I'm going to go over parts of the heart anatomical model. So we'll start with the top, okay, or the base of the heart. Here we have the superior vena cava. Here we have the entire aorta, but it can be further subdivided into the ascending aorta, the aortic arch, and the descending aorta, the small part of it. Okay, and off of the aorta you have three branches that goes into arteries. This one I abbreviated as BCS. B stands for brachiocephalic artery, C for left common carotid artery, and S for left subclavian artery. And then here we have the pulmonary trunk, knowing that this is the anterior view of the heart. And then from the pulmonary trunk, it branches into your pulmonary arteries. Arteries because it is blood moving away from the heart. And once blood goes into the pulmonary arteries, goes into the lungs and imaginary lungs, comes back via your pulmonary veins. So these two right here are the pulmonary veins, and then moves into the left atrium of the heart. And then from there, blood moves from the left atrium into the left ventricle of the heart. On this side, you have right atrium of the heart and right ventricle of the heart. Okay, and in addition we have coronary arteries that surround the heart, anterior and the posterior side. Okay, how you can tell this is the posterior side is this giant hole. This giant hole is the bottom or inferior vena cava. Is a hole, but it has a tube that will extend further down into the body. But it's just represented by a hole in this particular model. And let's go over the coronary arteries. So this one right here is the right coronary artery. From the anterior view, that red one right there, this is left coronary artery. And then the red one going down the middle of the heart from the anterior side is called the anterior interventricular artery. And then we have veins. Vein, this big blue one, we just collectively need to know it as great cardiac vein. Great cardiac vein. Now on the posterior side, we have again the red one being called the posterior interventricular artery. And then we have the blue one right here called the middle cardiac vein. This one right here is called the coronary sinus, where all the blood drains back into the right atrium. And that is all for the external parts of the heart. Oh, and one more thing, down here is called the apex, the tip of the heart. Now, moving on into internal structures of the heart. Okay, so the internal structure of the heart, you have here again the right atrium, right ventricle. How you can tell is by the thickness of the myocardium layer. Right ventricle is thinner in the myometrium, the myocardium layer compared to the left ventricle. Okay, so that's why this is the left atrium. This is the left ventricle. And you know this is the left side because of the fact that it has a much thicker myocardium layer. All right, and then you have valves. These two valves that goes between the atrium and the ventricle is collectively called the AV valve or the atrioventricular valve. But if you want to call them separately, the one that goes between the right atria and the right ventricle is called tricuspid valve because it has three cups inside that makes up the valve. Okay, And then the one that goes between the left atrium and the left ventricle is called the bicuspid valve, okay, which is this portion, okay, not the little lines, but this portion. is the bicuspid valve, tricuspid valve. And then these little lines here, it's called the chordae tendineae. Chordae tendineae. Only AV valves have it to pull on the valves so that they don't reverse back into the atria, causing regurgitation of the blood. So what pulls on the chordae tendineae are papillary muscles here, or here, this is also papillary muscles, okay? So blood then from the right atrium goes to the right ventricle through the tricuspid valve, then goes up into the pulmonary valve before they get into the pulmonary trunk. On the left side, you have left atria, blood moving from there through the bicuspid valve into the left ventricle, through the aortic valve right there to go inside the aorta so that blood can go into the systemic circuit. On the other hand, blood then moves into the pulmonary trunk, goes into the pulmonary circuits. In terms of layers, you have the outer layer, which is called the epicardium, muscle layer I already mentioned being myocardium, and then the inside layer here called endocardium is the interventricular septum, which is that piece of muscle, cardiac muscle, that separates the two ventricles.